more studies looking at balance exercises. Doing balance exercises can reduce risk of falling. Looking at visual proprioceptive training is using your visual cues and your surface cues, whatever you're touching onto. By doing some balance exercises involving that, again, we're seeing some decreased risk of falling, improved walking speed, so overall, improved mobility. If your balance is better, whether it's in sitting or in standing, even if you're not able to ambulate, if your balance is better in sitting, you're still going to be able to transfer better and move around more effectively. And another study from 2007 confirming brief, moderate exercise improves fitness. So all these are positive. This is all positive news about MS, and no evidence for the worsening of the symptoms. And that was always the concern, back 20, 25 years ago, is this going to make me worse? So this is what I like to see, because I hear just about all of them, and we probably all use them. I've used lots of these in the past. I don't like to exercise. There's always lots of reasons why people don't want to exercise. It's too hard. Yes, it's hard. I'm not going to stand up here and tell you that it's easy to exercise. It's difficult. I don't have a way to get there. That's a legitimate reason here in Metro. It costs too much. Hopefully, we'll talk about different options. It makes me tired. Yeah, it may make you tired, but hopefully you get past that, and eventually it makes you start feeling better. You get out of that fatigue cycle. Balancing it with the rest times. Using that's a great analogy with the banking theory, okay? I don't know anyone, okay? That's a good reason I've heard. And the best one yet, my shoes aren't the right color. Yes? So recommendations for exercise for people with MS. Make sure you're exercising in a cool environment. So check out where you're going to go for your exercise program. Is it air conditioned? Exercising earlier in the day, beating the heat of the day. I know when I set up my community-based exercise programs, we exercise in the morning. We make sure that the room is air conditioned. Sometimes the air conditioning isn't working, but we try. Consider the balance issues. Is there something for you there for you to hold on to? Or is it sitting exercises versus standing exercises? Are there people to help you? And go to the bathroom before you're starting the exercise program. Staying well hydrated is really important. That will help you with that core body temperature issue. Your proper footwear and clothing. Footwear for balance, clothing so you can move and groove. Right? You don't want to have tight, restrictive clothing on. Safe environment. Make sure that you are going to pick an environment that is safe for you. And exercising with a partner is a lot of times very motivational for people versus trying to go out and exercise on your own. And consulting with your physician to make sure it's the right time for you to be starting and that there's no other contraindications for you starting an exercise program. And it's always good for your family doctor or any physicians involved in your care to know what's going on with how you're managing your disease. Exercise options. As I mentioned at the beginning, I think there's physiotherapy exercise programs is really just one option. Okay, if you think about your community and where you live, there should be lots of different options for you to exercise. Programs can be individual or they can be group. They can be based at home. They can be based out of a community facility. There's pool programs, exercise classes, and I'm finding more and more in the community that there are more adaptive type of exercise programs. There's seniors fitness programs, there's chair-based exercise programs, there's yoga classes and Tai Chi classes that are designed for people with mobility issues so that maybe are done in sitting. So sometimes it's just a matter of doing a little bit of investigative work in your community. There's lots of different community centers around. They don't have to be the big, flashy ones like the Dowplex or Cole Harbour Place. They can be the small little community centers out in Chocolate Lake. Lots of good programs working there. Physiotherapy sessions, that can be part of it certainly as well, and they can be done in clinic, in hospital, or home programs. And sometimes the physiotherapy programs are done as an adjunct to what you're doing as far as your exercise in the community. And walking programs, I think walking is one of the most underrated type, or propelling your wheelchair, whatever it may be, on a treadmill, stationary bike, just something that you can do maybe individually. Okay, there's some few points that you want to take into consideration when you're thinking about trying to exercise, set up an exercise program. Paula's point about the schedule, great. Plan your week in advance about what you're going to do, how you're going to fit it in, how you're going to balance it with your rest, how you're going to balance it with your other responsibilities that you have during your week. I think it's hard to get up in the morning and just go, okay, today I'm going to go to the gym. Okay, I don't think that's working. I think setting up that schedule in advance it's much more beneficial. You want to look at the cost. Okay, there's a lot of very cost-effective programs. There's a lot of very expensive options out there. So you want to see what's fitting into your budget. Accessibility. What are you going to be able to get to? Are you going to be able to use Accessibus? Are you going to be able to use a power scooter to get there? Do you have your own car? Do you have someone who can pick you up? That's important. And the building itself. Look at the accessibility of the building. Is there a washroom nearby that's accessible as well? So location, something in your community. If it's easy to get to, chances are you're going to stick with it better than if it's something that's just really difficult to get to. So location, I think, is really important. The level of intensity, it's got to fit you. We're all individuals here. We all have different needs. And so you've got to find something that you like to do, that fits you, and that fits your level of what you're capable of doing. And sometimes that can change. I've had people start in my exercise program, and then they graduate on to other programs within Cole Harbour Place. That's great. They graduate on to pool programs or a seniors fitness program, and that's fine if they find my level is not challenging them enough anymore. The leadership, that's really important. You got to kind of jive with the leader. I went to a boot camp class last winter, and at 6 o'clock in the morning, someone's screaming and yelling at me first thing in the morning. No, that just wasn't for me. I need to put my headphones on and go to the gym and be by myself. So the other women in the room loved it. They loved it. So everyone has different, the type of leadership they like and respond to. So your personal preferences definitely has to come into play. Right? Don't let someone else dictate to you what's going to work for you. When I'm working with people setting up exercise programs as such, which may include physiotherapy, I always say, what do you like to do? What do you respond to? Do you like the pool? Do you like to walk? Do you like to be outside? Do you like to be part of a group? Do you like to do things on your own? So that's got to be taken into consideration. Pick an activity you like to do. Set yourself that schedule. Look at your week in advance, see what kind of commitments you have in there with home and work, and see what's going to work for you. Celebrate your milestones. Really, take if you've finished your first month of going to class, twice a week, great. Take yourself out for a coffee. Call someone up and say, let's go out and celebrate. I just finished a month of regular exercise. Celebrate those milestones. That's really important. Reward yourself. Get the right gear, get the right clothing, get the right shoes, so that you're comfortable when you're doing your exercise, that you feel safe when you're doing the exercise. And if you get something really flashy, like some of the ladies who come in and they've got these sparkly tops on, and they just want to show off their top. They're not there they're just there to show off their tops. But if it gets them to class, whatever works, that's fine. You have to consider your rest, as we talked about, and your nutrition. Okay, you've got to make sure that you're living that healthy lifestyle, taking into account your nutrition, because then you're going to feel better about your whole exercise routine. If you're not getting good nutrition, you're not getting good rest, you're not well hydrated, you're not going to feel very good when you're exercising. And that's anyone, not some necessarily just with MS. Set yourself some goals. Say, I'm going to go to class once a week. I'm going to do my arm weights once a day. I'm going to push myself around the block 3 times this week. Whatever your goals are, just think about what your goals are, make sure they're realistic, and just try to stick with them. Okay, and if you need someone to help you set those goals, that's fine, but make sure that they are listening to you about what is important to you and what you like to do. There. So adding exercise into your life is a lifestyle change for some people. So for some people, they've never exercised before. So when they sit down and we start talking about exercise, and they look at me like I've got 3 heads, and I'm going, you really don't want to exercise here, because it's new for them. But if you can really look at the advantages, the benefits, stick with it, get over that initial hump of I really hate this, and get into the good stuff, get into the benefits of being part of a group or enjoying the solitude of the exercise, whatever it works for you. But try to find something that fits into your lifestyle. One good thing will definitely lead to another. And the whole talk tonight is about mobility, and I think what we're looking at is if you can get yourself working on your strength, on your flexibility, on your balance, on your coordination, all of those things, even a little bit of improvement in each of those areas should help you with your overall mobility, no matter what level you're working at. And I firmly believe that it doesn't matter what level of ability you are working at, there's some way that you can do some sort of exercise. Okay, thank you.
I'm going to talk a little bit about medication now. And I think that Paula's and Sue's presentations, the big thing that they point out is all the really important non-medication things that we can do. But even when we do all those things, sometimes we still have residual symptoms or other things happening with our MS where medications do play a role. So I'm going to talk a little bit about that tonight. So the medical management, again, is not just medication. We have all these other wonderful evidence-based things that we've talked about tonight that can help your mobility directly, that can help other symptoms like your fatigue, which indirectly help your mobility, or your spasticity. So those things are really important. So to target MS symptoms that affect mobility, sometimes we're treating related things: spasticity, bladder symptoms, pain, fatigue. You know, some people I ask about their bladder and they say, well, I'm here about mobility, why are you asking about my bladder? Well, if you're up 2 or 3 times at night to pee, well, then you're going to be not rested in the morning, so that's going to impact your fatigue and that's going to impact your mobility. So it's really important to have a good assessment and look at all the areas in your life related to your MS, and sometimes things outside of your MS that could be impacting that mobility. Make sure we're taking care of them all. If your legs are really stiff from spasticity or not well coordinated, then by improving that spasticity, we may indirectly improve your walking. And we've done some research that actually shows that's true, and I'll talk a bit about that later. So again, as I mentioned earlier, medical management, each of you is an individual with individual needs and individual factors around your MS. So you each need to be treated as an individual. So that's really important. A lot of the time I'll have patients come in and I talk about a medication, whether it's for spasticity or mobility, and they say, oh, well, my friend Joe, he tried that and it just didn't work for him. It made him too tired or whatever. Well, Joe's a very different person, and so you need to kind of keep that open mind. And because something doesn't work in one person, it can still work in somebody else. So just some examples. So I'm going to talk a little bit about what's new, because people always like to hear about what's coming, okay? So I'm going to talk a little bit about famperine and mobility. So I don't know how many people here have heard about famperine. Some of you probably have been hearing me talk about it in clinic for 7 or 8 years and are waiting, and every time I think maybe by next spring it'll be available in Canada. But by this spring it should be. It's actually, the paperwork's with Health Canada now, and this is a drug that hopefully will be approved on the market by the spring of this year. And it's already been approved in several other countries. It's available in the United States now, in Australia, New Zealand, and in Europe. So it's hopefully just a matter of time. We need to get it through Health Canada.